If you're over 60 and your lower back has been killing you, stop. Stop doing those stretches you found on YouTube. Stop trying to stand up a ramrod straight like you're in the military. And stop arching your back because somebody told you it's good for your spine. I know that sounds backwards. You've been told your whole life to stand tall, straighten up, pull those shoulders back. But here's the thing, that advice was never meant for your spine. It was meant for a 30-year-old spine, and yours is different now. And that's okay, but you need to know the difference. If this is already making sense to you, go ahead and hit that like button right now and stay with me to the end because I've got a bonus tip about something most people already have in their kitchen that can actually help calm this pain down from the inside. You're not going to want to miss that. Here's what's actually happening in your back. When you were young, the little discs between your vertebrae, think of them like jelly donuts, were plump and full. They kept plenty of space between your bones. Back pain back then meant a disc had bulged backward and was pushing on a nerve, so the fix was to arch your back and open things up. That worked. But after 60, those discs have naturally flattened out over time. They dry out a little, like a sponge that's been sitting on the counter. The space between your bones gets tighter. Doctors call this stenosis, but all you need to know is this: there's less room in there now. So when you arch your back or stand up extra straight, you are actually squeezing that space even tighter. You're pinching your own nerve with your own bones. It's like stepping on a garden hose. You can run the water all you want, but nothing gets through until you take your foot off. Arching your back is the foot on the hose. And here's the part nobody tells you. The harder you try to fix it with those YouTube stretches, the more you tighten that grip. Every time you reach down and pull that leg back, every time you try to crank your hip open, you may actually be making the nerve angrier. You're not stretching a muscle, you're pulling on a trapped nerve. That's a very different thing, and it deserves a very different solution. So what actually helps? The opposite, a gentle, controlled rounding of the back. When you slightly round your lower back, even just a little, those spaces between your bones open back up. The nerve gets room. The pain backs off. This is why a lot of people with lower back pain naturally hunch forward when they walk. Their body is doing it on purpose. It's not bad posture. It's your spine trying to protect itself. Don't fight it. Think of it this way. Your spine is smarter than the advice you've been given. Start listening to it. Here's the one exercise to start with. You can do it right now in your bed. Knee to chest. Lie flat on your back with your knees bent and your feet flat on the bed. Take a slow breath and let your lower back sink into the mattress. Now, slowly bring your right knee up toward your chest. Don't yank it, don't force it, just gently pull it in until you feel a mild stretch in your lower back and your right buttock. If your knee bothers you, don't grab the kneecap. Clasp your hands behind your thigh instead. Hold it there for 5 seconds. Breathe. Let the tension melt. Then slowly lower that leg back down. Do the same with the left knee. You might notice one side feels tighter. That's completely normal. Your body has probably been leaning and compensating for months, maybe years. Just be patient with the stiff side. It'll come around. Once you've done both sides, try hugging both knees to your chest at the same time. You can even rock gently side to side. Your back gets a little massage against the mattress. This position flattens out the curve in your lower back completely, giving that pinched nerve the maximum amount of space to breathe. Do this sequence about 10 times. There is no rush. This isn't a workout. This is you giving your spine the relief it's been asking for. Bonus tip. The food that fights back pain from the inside. Now here's that kitchen secret I promised you. One of the sneaky reasons lower back pain hangs around, even when you're doing everything right, is inflammation. Your body is in a constant low-level state of irritation, and that inflamed tissue around the nerve makes everything more sensitive and more painful. The good news? There's a food that has been shown to fight that inflammation naturally. Turmeric. You've probably seen it. It's that bright yellow spice, the one that stains everything it touches. It's been used for thousands of years, and modern research has backed up what people already knew. The active compound in turmeric, called curcumin, is a powerful natural anti-inflammatory. You don't need to do anything fancy with it. Stir half a teaspoon into warm milk or your morning oatmeal, add it to scrambled eggs, throw a pinch into soup. To help your body actually absorb it properly, add a small crack of black pepper. This simple combo makes the curcumin up to 20 times more effective. It's not a magic cure, but if inflammation is quietly feeding your back pain, and in most people over 60 it is, then reducing it from the inside is one of the smartest, simplest things you can do. It works alongside the exercise, not instead of it. Consistent, cheap, already in most grocery stores, no side effects. Just start adding it to your food this week and give it 10 to 14 days. That's it. And if this video helped you today, please hit that like button. It takes 1 second and it genuinely means the world. See you in the next one.